Surgical operations. Flaps and grafts. Flaps. Definition. Any lifted type of tissue from a donor site moved to a recipient site with an intact blood supply to fill a defect. Classification of flaps according to the complexity. Local flaps, freeing a layer of tissue and stretching it to fill a defect. Advancement flap, rotation flap, transposition flap, distant flaps. The donor site is far from the defect. The most complex flap, direct or tubed flaps are connected to both the donor and recipient sites, simultaneously forming a bridge. This allows blood to be supplied by the donor site while a new blood supply from the recipient site is formed. Once this happens, the bridge can be disconnected from the donor site if needed, completing the transfer. Cutaneous flaps contain the full thickness of the skin and the superficial fascia. It is used to fill small defects. Fasciocutaneous flaps, adding subcutaneous tissue and deep fascia. The blood supply is more robust. They fill a larger defect. Musculocutaneous flaps, adding a layer of muscle. This flap provides bulk. It can fill a deeper defect. Muscle flaps provide bulk or functional muscles. A skin graft can be placed over it if needed. Bone flaps used to replace bone. Jaw reconstruction is an example. Axial flaps, supplied by a named artery and vein, allows for a larger area to be fed from the surrounding and underlying tissue, leaves only a small pedicle containing the blood vessels. Reverse flow flaps. It is a type of axial flap. The supplying artery is cut on one end. The blood is supplied by the backwards flow from the other direction. Random flaps are simpler flaps. They have no named blood supply, supplied by generic vascular networks. Pedicled flaps remain attached to the donor site via a pedicle containing the blood supply. Grafts. Grafts means moving tissues from one body site or from another person to another body site without bringing its own blood supply with it. In some instances, it might be an artificially manufactured device. Types. Commonly grafted tissues are skin, bone, nerves, tendons, neurons, blood vessels, fat, or, or cornea. Reasons of failure of the graft: hematoma formation, infection, seroma formation, shear force. This disrupts growth of the new blood supply. Unsuitable bed for new blood supply growth, like the cartilage, tendons, or bones. Good luck and best wishes.